Kidney cyst, also called as renal cyst, very important topic with respect to the entrance exam, UG to PG and also PG to DM. How to classify this? What are the categories? Because there are so many disease comes under this category, like autosomal dominant polycystic kidney disease, autosomal recessive polycystic kidney disease, simple cyst, those things. To understand that broadly, you should know what are the categories. It can be called as kidney cyst categories or kidney cyst type, or you can say as classification. Okay. So broadly, kidney cyst can be classified into two types: genetic and non-genetic. What are this genetic? Genetic, as you know, it is associated with some kind of inheritance, gene related issue. And another one is the non-genetic, directly won't be having any impact with related to the inheritance, but is occurring. So it is two types, genetic and non-genetic. If you take the genetic, under genetic there are three categories, very easy to remember: autosomal dominant, autosomal recessive, and third one is the X-linked. X-linked is very, very rare. As you know, which is the most common one? Autosomal dominant, under which there are diseases particular. What are those? Autosomal dominant polycystic kidney disease, autosomal dominant tubulointerstitial kidney disease, some syndromes like von Hippel-Lindau syndrome, tuberous sclerosis complex. These four: autosomal dominant polycystic kidney disease, autosomal dominant tubulointerstitial kidney disease, von Hippel-Lindau syndrome, and tuberous sclerosis complex. These are all the diseases where inheritance occurs through the autosomal dominant mode. The second one is the autosomal recessive. In this, the inheritance is of recessive mode, under which the common one is the ARPCKD, autosomal recessive polycystic kidney disease. Nephronophthisis, nephronophthisis also comes here. So these are the two important diseases under this category. The last one is the X-linked, very, very rare. In this, at least, not only kidney, the other system, there is a syndrome, orofacial kidney syndrome, where the X-linked inheritance might be there. But as of now, just remember there are three categories under the genetic: dominant, recessive, and X-linked. Out of which is the most common? It is ADPCKD. This is the most common. These are the categories under which the genetic cystic kidney diseases are there. I hope you understood. Genetic is very easy: autosomal dominant, recessive, and X-linked. Now coming to the non-genetic one. Now, in the non-genetic, it can be again classified as acquired and developmental. During the developmental of the phase of the kidney, the cysts are occurring. Acquired, it is most common. So genetic, we have seen three categories. In the non-genetic, we are having two. One is acquired and another one is the developmental. Under acquired, the most common is the simple renal cyst. Simple cyst, that in the OPD, in the ultrasound, you might get without any much complication. The size will be less than 4 cm. As the patient gets older, these cysts are very common. The second one is the simple cyst. Simple cyst. Second one is multilocular cyst. Third one, cyst which has because of some electrolyte abnormality, to be specific, cyst related to hypokalemia. And the last one is the cyst which occur in the CKD. CKD also over a long period of time leads to the kidney cyst. So these are the four categories of acquired cyst. If you take the developmental, in developmental also there are two types. The first one is the dysplasia, cystic dysplasia. Cystic dysplasia. It can be syndromic, associated with syndrome, non-syndromic. not associated with syndrome. So in the kidney cystic dysplasia, it can be simple cystic dysplasia, multilocular dysplasia, or dysplasia associated with other urinary tract abnormality. It is occurring alone, occurring along with some kind of urinary tract problem. Third one is the multicystic kidney dysplasia under the developmental cystic dysplasia, in that syndromic, non-syndromic. So this is the broad category. Either of this can occur as syndrome or non-syndromic overall. The another one is the medullary sponge kidney. Medullary sponge kidney. With respect to the medullary sponge kidney, nowadays there are evidence it being inherited, as it occurs as sporadic also as inherited also. So as of now it is being classified in the non-genetic one, which is medullary cystic kidney disease. Sorry, medullary sponge kidney, MCKD, that category now went into TIKD. So don't confuse those. So that's all. Overall, this is how a kidney cyst classification broad outline is. So we'll go through it once. So if we take kidney cyst, it can be genetic or non-genetic. In the non-genetic, the most common being the autosomal dominant polycystic kidney disease. There are three categories: dominant, recessive, X-linked. X-linked is very rare. Autosomal dominant polycystic kidney disease is the most common. Under this, ADPCKD, ADTIKD, Pony-Hippel Lindau syndrome, and tuberous sclerosis comes. Whereas if we come to the non-genetic, acquired and developmental, majorly it is kidney cystic dysplasia. In the acquired, if you take simple, multilocular, hypokalemia and CKD related. That's all. This is the broad outline of kidney cyst categories. Bye-bye.